The measurement of blood pressure is one of the foundations of prenatal care. Taken at virtually every prenatal visit, it is the clinical tool which is used to predict and detect hypertensive disorders of pregnancy. Preeclampsia, which is one of the more severe forms of hypertensive disorders, has significant implications for both pregnant individuals and their babies, with more severe cases leading to worse outcomes. So you must be wondering why we need a standardized screen for preeclampsia. This is because studies have shown that low-dose aspirin, when given in the proper doses at the right time in pregnant individuals at risk of preeclampsia, reduces the likelihood of getting it by up to 60%. Recent literature has endorsed a validated multiple marker screening method for preeclampsia, which incorporates background historical factors with current pregnancy factors. This algorithm improves our ability to identify high-risk individuals who would benefit from the timely introduction of aspirin compared to those who are low risk and thus require standard care. What is this multiple marker screen for preeclampsia? It includes a standardized history composed of items we usually identify in the prenatal record, such as pregnancy type, dating, maternal characteristics like height, weight, and race, past maternal medical history, as well as obstetric history. It also includes an ultrasound marker and blood markers drawn at the 11 to 14 weeks prenatal visit. An essential component of this multiple marker screening method is a standardized blood pressure measurement, which is different from what we routinely do during the rest of the pregnancy. Most of the healthcare providers measure the blood pressure of their pregnant patients during prenatal visits, often taking one or two measurements with no established protocol and using a manual instrument. However, the standardized method of measuring blood pressure that is accepted worldwide has some components. First and foremost, make sure that the pregnant individual is well rested for at least 5 minutes before blood pressure measurement. It is important to make sure that you have an appropriate cuff size with the bladder length covering 80% of the arm circumference and the bladder width covering 40% of the arm circumference of the pregnant individual. The automated method of blood pressure measurement is recommended. Make sure the pregnant individual's back is well supported, with both legs uncrossed and both feet touching the ground. Both arms are well supported and not hanging freely in the air. The blood pressure cuff is at the level of the heart. It is recommended that 2 measurements be taken simultaneously in each arm, and blood pressure is obtained by the average of these 4 values. Once blood pressure is measured using the standardized method, it is entered into the screening algorithm and preterm preeclampsia risk is generated. For those pregnant individuals at risk, more than 1 in 100 are then classified as high risk and will benefit from offering low-dose aspirin. Thank you so much for viewing this video. Once you have viewed it, please move ahead with the post-video survey by clicking on the link provided in the description below the video.